Before we begin the maneuver, we need to introduce ourselves to the patient. Kennedy, my name is Brett Bell. I'm the student physical therapist. We also need to ensure that the mat is at the proper height to allow for the best body mechanics as the healthcare professional throughout the maneuver. We need to ensure that plenty of space is cleared so that the maneuver can occur without complications. And we also need to check for G-tubes or any other wires in the abdominal region that may get caught. If this is the case, we may need to use an abdominal binder. Finally, we need to determine if there are any assist levels needed for this patient. This will tell us how much assist we need to provide and how much of the work the patient is doing themselves. And then throughout the movement and at the end of the movement, we need to ask the patient for any needs or if there is any discomforts they have. The assist level of this patient was determined to be contact guard assist, which means that I'll place one hand on the anterior part of her thigh and the other hand on the thoracic region that's in contact with the mat. We see that the patient is in the proper starting position with her arm horizontally adducted at the level of the shoulder, just in front of the wedge. Her hand is on top of the wedge to allow for some assist, and the wedge is at the level of the upper chest. Her legs are also slightly flexed at the knee to allow for a roll onto the wedge. So what we need to do is inform the patient of what they're going to be doing. Kennedy, what you're going to do is we're going to roll you onto this wedge so you're laying on your stomach. Is that okay?
Yep.
Okay, Kennedy. Now what we need to do is, on the count of 3, we're going to pull this arm back. You're going to bend at the elbow, and then you're going to lift this part of the trunk so you're sitting on the side of your elbow. Is that okay? Okay, on the count of 3. Ready? 1, 2, 3. For contact guard assist, I'm ensuring to keep contact the entire time to assist as needed. Okay, Kennedy, can you reach across to that side of the wedge? And then on the count of 3, what we're going to do is we're going to pull you onto the wedge so you're facing that way. Ready? 1, 2, 3. And then we reposition our hands, assist them moving forward on the wedge. We ensure that the forearms are flat on the mat in front of the wedge, and if they are not, we need to place padding or a pillow underneath to make sure that the forearms and the humerus are in the right position. And then we realign the legs with the trunk. Now what we need to do to get her off the wedge is we need to slide her over to the side of the wedge she'll be rolling off of. Okay, Kennedy, can you slide to this wedge? Ready? Okay, and now we place the arm in the correct position to allow for the proper slide into the beginning position. So we're going to internally rotate the arm that's in contact with the wedge. Kennedy, on the count of 3, what we're going to do is we're going to roll you back off of this wedge, and when we do that, I need you to slide that arm that way so you're in the position we started. Ready? 1, 2, 3. We're doing this slowly and controlled to make sure safety is met. And then we reposition her in the starting position she was before. Now for a moderate assist level, what we do is, as the healthcare professional, we provide about 50% of the assistance. And then we start in the same position as we were before. Kennedy, what we're going to do again is we're going to roll you back onto the wedge. Is that okay?
Yep.
I need you to help me as much as you can. So to start, what we're going to do is we're going to slide this arm back, you're going to bend at the elbow, and you're going to pull this part of your trunk up. I'm putting them back in the position of contact guard assist, but I'm doing this to ensure that when we roll onto the wedge, this hand controls the roll of the legs, and this hand helps lift her trunk off of the mat and onto the wedge. Okay, on the count of 3, we're going to go to your side. Ready? 1, 2, 3. Okay, and then Kennedy, can you reach across there? Hold that part, and on the count of 3, what we're going to do is we're going to pull you onto the wedge. Ready? 1, 2, 3. We lift up here, we reposition, and then we make sure her forearms are in the same position as they were. As needed, we would provide pillows or padding, and then we reposition her legs so they're in line with the trunk. Now to get her back off the wedge, what we're going to do is we're going to do the same thing we did for contact guard assist. Kennedy, what we're going to do is on the count of 3, I'm going to slide you to this side of the wedge. Ready? 1, 2, 3. And then we internally rotate the arm. Kennedy, as we slide off of this, I need you to slide that arm back to the position it was before. On the count of 3, we're going to roll. We'll do this slowly and controlled again. Ready? 1, 2, 3. We ensure she's in the same position she was before, with her legs on top of each other, slightly flexed, and her arm at the horizontal adduction at the level of the shoulder. Kennedy, is there anything else we need, or do you have any